Hello, my name is Cary. I'm the CEO of the UICC. As we progress towards the World Cancer Leaders Summit, it gives me a great pleasure to welcome someone who has probably as much passion as I do about cancer control around the world. From Novartis, Susanne Schaffert. Perhaps you could introduce yourself, Susanne, and tell us a little bit about you before we go into some questions.
Sure, Cary, really happy to be here. I'm leading the oncology division of Novartis. And what you have to think about it is 10,000 people dedicate to cancer every day. In our life, we are spread in 85 countries around the world. And as you said, it's my big passion to find cure for cancer patients everywhere in the world and whenever patients need it.
Well, I've got to say that sort of filters through to everyone we meet in Novartis who worked with you out of that large number. So it's certainly part of the company's DNA. We've had a pretty rough time in the last couple of years with COVID, and it's affected a lot of what we do in our lives, but also affected the patients of cancer as well as their families. So what do you think have been the big issues that the cancer community has faced in cancer control during the pandemic?
Yeah, I mean, when I remember back, it was a big shock, certainly, for everybody working in the cancer community. And what we focused on as a company was to ensure that just patients that were already on therapies got their medicines and got their therapies delivered wherever they needed it. So that was a big challenge. But then also, of course, I think the biggest and quite severe impact is on diagnoses that were paused and they were lost. And we talk really millions of people that did not do their screenings, maybe ourselves also paused. But that's where you detect cancer early, and that's very critical. But then even in later stages, we know, for example, from Europe, just to give a number, that there is probably 1 million of people not being diagnosed. That would be the usual rate. And that's certainly very, very severe. And we know cancer does not wait until the pandemic is over. Cancer is progressing. What I also saw, which for me is very worrisome, that people that were already aware of a cancer diagnosis, they usually have to go to their monitoring visits and screening visits every 3 to 6 months. And also that was paused. So, and in a way, cancer did progress in many cases, which put then patients in a position with a worse outcome and really less hope for extending their lives, which is really sad.
No, I agree with you. We've called it the big cancer catch-up that we're facing now, because those cancers have not gone away and they're probably going to present later. So it is an extremely large worry in many communities around the world about how we're going to deal with those cancer cases as they present successfully as well. One of the things the pandemic has done is it's highlighted the inequities in the health system, in society more generally. And I mean, we certainly have had worries that it's made it more difficult for smaller groups of individuals in each country to get access to health, etc., etc. So, what have you seen in regard to the inequities that have emerged through the COVID pandemic, specifically for cancer?
Yeah, I mean, the whole pandemic has probably set the progress on cancer back by almost a decade. And when you now look at new numbers, there is expected to be 76 million people in the frame of 2020 to 2030 to die from cancer. What is the sad news about that is that even out of that, 70% will be patients in low and middle income countries, which shows you there is not a fair balance between outcome and there's huge inequities. And just to bring an example of a very developed country like the United States, also there you see there was a lot of research done that when you look at women with breast cancer, for example, unfortunately, women with Afro-American backgrounds are 40% more likely to die of cancer than Caucasians. That's certainly an inequity that has to be addressed. And we believe it starts from how medicines are developed, how screenings are done, how treatments are offered. And certainly we really engaged a lot on that. We launched a program that is called More Than Just Words, that really works with centers that address equally Caucasian and Afro-American population, so that really everybody has the chance to get a proper treatment.
You're so right. I mean, I read this week that something like only 1% of lower middle income country people have had their second vaccination. And this has been running for some time now. So we have a global challenge as a community, which demands private sector working with governments, working with the NGO sector, working with the public generally. So there's a lot to be done. We do feel in UICC there might be some silver linings, though, and that health has now become a global issue, recognized by all governments as something we should invest in. It's also raised the interesting challenge of how we innovate as a society in order to solve those problems. Now, at the very heart of what you do is innovation. So I know that it's something that you're passionate about. What is your approach to innovation generally in terms of cancer control, treatment and care?
Yeah, I mean, when you think about the pharmaceutical industries, as you rightly say, everybody thinks about research and development, and that's certainly still a core of what we do. That's the innovation we have to bring, but it's not enough. That's what I tell my team. It's not enough if we get a product to approval. It's only, our job is only done when every patient, wherever the person sits, will get our treatment. Then the job is done. And that requires innovation. And that's, for me, Cary, is a good thing about the pandemic, that this crisis has proven how possible innovation can be if stakeholders and different groups have the same vision. In that case, it was tackle the pandemic. In our case, it should be tackle cancer and provide the best outcomes. And when you think about novel approaches like telemedicine, that was known but was rarely used. When you think about some countries, especially low and middle income countries, for them, it's a lot about the infrastructure. There might be some well-equipped centers, but how does a patient get there? And patients many times cannot even afford to go to get the screening and the diagnosis. So how can they go regularly? It's just impossible. And when you see what telehealth has offered, it brings the physician to the patient with novel technology, with social media channels, with digital. I believe there is an opportunity. So my aim, actually, when you ask me, is how do we get back to where we were? My aim is to be better. That we, as you say, that's the silver line for me, that we, I think, should aim higher than where we were before the pandemic, as there is now so many tools available.
No, in UICC, we had plans like 3-4 years ago to create EUICC, which at that time we didn't really know about Zoom and everything else, but we imagined a scenario where the whole of the cancer community that are members of UICC will be interacting all the time on the web, exchanging ideas, best practice and ideas and views on what could be done in their country. I think we've accelerated progress to that without actually investing too much in creating an EUIC, because we've become like that over the last year. All of our interactions, the World Cancer Leaders Summit, which we are both attending, is virtual. And who would have believed that 3-4 years ago? So I agree with you. You mentioned the words build, I think build back better implied we could do things better. That's something which is a bit of a mantra from WHO, and we fully support that. We believe there's an opportunity here to build back better, but not just in terms of getting ready for the next pandemic, whenever that may be, but actually improving health systems overall and the accessibility of those health systems. So, I mean, I assume you share that belief that we have an opportunity that we can build better. And which ways do you think we can do that?
I absolutely have the same ambition, because that's the opportunity, what we learned from COVID. And I think it starts from all stakeholders that are interested and engaged in this topic to work together, wherever they sit, in industry, with official bodies like payers, regulatory, physicians, patient communities. That was the uniqueness about COVID, that everybody worked together to fight this virus. And I think it's a unique opportunity to do the same for cancer. I mean, you mentioned it, what you had in mind for UICC, and that's exactly, I think, what is the beauty, that, for example, education, knowledge is shared broadly, that everybody has access. That's what now is possible. And, you know, when you think about major journal like New England Journal, they all opened their channels. Everybody had access. So there was less of this privilege for only some groups to be able to access, for example, information. That is kind of the learnings we should take from the pandemic.
I agree with you, and there's lots of opportunities for sharing knowledge. One of the things that we say a lot in UICC is if we just deployed the knowledge we have, the tools we have, the medicines we have, the technology we have around the world, we wouldn't be so fearful about, as you mentioned earlier, the massive growth in cancers we anticipate in low middle income countries. Susanne, it's been a pleasure talking to you, and I must say that, you know, working with Novartis and many of our partners actually is so important to UIC and its members. Your support, your guidance, your advice, and your expertise, it definitely makes a difference to our community. So we'd like to say thank you very much. Looking forward to seeing you at the World Cancer Leaders Summit, unfortunately virtual, but maybe one day we'll get together at a summit or a congress. So thank you very much, Susanne.
Absolutely, Cary. Thank you so much, and good luck with all your great work. Thank you.
Thank you. Bye-bye.